1990. 1990. 1991. www.robcharles.com.
Good afternoon from wherever you are. This is Jojje, of course, as always, and I have my co-host here, Eric. And of course, today I'm bringing to you the Health Cabinet Secretary, Sigalagala National Polytechnic. This guy has done a lot today, and he has just held a health talk concerning the health issues of this school. Now, a quick one, Mr. Rogers. How exactly do you think this health talk is going to be of impact today to the comrades of this institution?
As he has said, I'm Namwendo Rogers, the Minister of Health, Sigalagala National Polytechnic, and I want to appreciate for taking your time, maybe for you to know more about our event today. Our event today is Health Talk, and we have organized for that because of our new sisters and our brothers who joined us last month. And the main reason is this: due to the rising number of STIs, HIVs, and early pregnancies, and maybe peer groups which have led to abuse of drugs and substances. That's why we had to conduct this event in order to sensitize them on what is going on the ground. And it's nice because majority have attended, and they will benefit. They will sensitize their friends, their colleagues on what we have discussed today.
Na wewe waziri wa afya, wasichana madada zetu wanapitia shida sana wakati wanapofika wakati wao wa hedhi. Unapata kwamba vile vifaa vya hedhi wanavyovitumia wanapata wakati mgumu sana wakimaliza pale ambapo wanahifadhi. Na umeona kwamba wameweza kuwa kuhifadhi ndani ya choo. Hivi vitu vinaleta katika shida, inachangia changamoto ambapo inachangia shida ya choo. Unalipi kusema ama solution gani ama ni mikakati ipi ambayo unaweza?
The issue to do with the sanitary pads and maybe disposable sanitary pads for our ladies has been considered. And this issue, we had an issue with the cleaners. We used to have cleaners who are very rude. They could not cooperate with us. But it's good that we God had our prayers. And at this time we have a new team. And the new team is coordinated them a meeting, and they are ready to serve us by ensuring that we have a place or those the bins where they posting all those the sanitary they use sanitary pads. I think that issue has been very rampant in this country because most of the toilets are blocked due to the issue of now they don't know or they don't have where they can put their things.
Okay, Mr. Rogers, health is something very, very important, and especially during these times of COVID-19. We've been moving around the school together with other students and are complaining that the water points that you people had put in place for maybe to ensure that they get to wash their hands to curb maybe the spread of coronavirus. Nowadays, the students are saying that, number one, you get to miss, there is no water in those tanks, that's number one. Number two, when you walk into the latrines that they have, you find that you cannot be in a position of flushing the latrines, meaning there is bad smell coming out of that place, that's number one. Number two, the high chances that they can get maybe to contract few diseases and viruses when they visit those places. And these are places that maybe people need to ease themselves. So what is your take about maybe water challenge, that is number one, and maybe to add on during this time of coronavirus, I can see around students or other comrades moving around without face masks. How exactly do you think you can put in place awareness to create for these students so that they can always be on their face masks?
The issue to do with the masks, the issue to do with the water points, the issue that was addressed when we were still at home. And the moment the communists came in, they vandalized all the equipments, all the water points, and at this time we are having a hard time to maintain those water points and the automatic sanitizers. Why? Some of the students even took the automatic sanitizers when you come to issue with the mask, it's a lot of now using common sense. You know there's corona, but our comrades are ignorant. Most of them, they only put a mask when they want to pass the ticket. After that, a class will be under a mask. So where it has reached is now a matter of now life and death. Wacha mtu aumie juu anaona wenzake wakiumia na hawezi jihadhari, wacha mwenyewe aumie. But to do that, we have organized a meeting with the class reps and the commissioners, all the commissioners, vendor reps, with the Minister of Education. We want to give out sanitizers to all the class reps. And this time it won't be easy because you'll be required to sanitize. The moment you enter class, you'll be required to sanitize. Then the moment you'll be found inside the school compound without a mask, that's when you'll be jacked out of the school. And it is very serious. And it will come with a penalty because if you can be caught 2 times or 2 consecutive times without even a mask and you are the same person, then it means you entering this institution will be hard. They will take your school ID, and without a school ID, maybe it will not be a health center. Yeah.
Abana kiongozi, naomba kukuuliza waziri wa afya kuhusiana na swala zahanati hapa shuleni. Kwanza nauliza zahanati ya shule ipo, na kama ipo iko tu kwa misala mijengo ama ipo ina vifaa? Hicho kitu cha kwanza. Kitu cha pili kwamba wanafunzi wengi wamekuwa wakienda katika zahanati ya shule na wapati huduma. Imewalazimu sana kutumia pesa kugharamika kupata huduma za afya kutoka nje. Hivi una mikakati gani kuhusiana na afya hapa ndani ya shule?
Okay, the issue is maybe the management of our dispensary, the manpower and the services there. It's an issue that many ministers of health have tried to address, but it has been a challenge to them because they lack support from their seniors. Secondly, they lack support from the administration, and it has been a challenge on my side for these 4 months that I've been in leadership. But I've tried my best. We have, at the moment, they are constructing a lab whereby all the services to do with the lab are carried out from there. At the moment, we made a decision because we don't have a nurse. Our nurse who was there left with some reasons, or medical reasons. So we are expecting this month of October, we receive more manpower. And that's when we will sit down with the new staff in the dispensary to ensure that we make a requisition or we order for drugs that will help our community. The services have been very poor that I will admit. The services have been very poor, but as time goes by, they are improving. The moment we will have that medical lab working, that's when we will see things moving smoothly. But at the moment I can say maybe we are trying our best.
Okay, thank you so much, Mr. Rogers, for giving us your time. Of course, we know that you have a busy schedule. I think we'll plan a day and then we have a very good talk with you, right? And for that case, of course, you know, this is Jojje TV. I've been your host, Jojje, together with my co-host,
Erica Hen.
Thank you.
Yo, what's up?
Baby, let's go.